This time I'll call to order the January 19th, 2023 meeting for the Dickson County Commission. Would you please stand and join in the flag salute? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have one item to add to the agenda, and that would be a culvert bid. And so I would move that we include that and approve the agenda as amended.
I'll second that.
We have the motion and the second. Any discussion or question? All in favor say aye.
Aye.
Opposed? Motion carries. The consent agenda includes the minutes of the January 12th meeting, also payroll of $511,077.19. The utilities wire of $10,536.23. A credit card wire, $18,311.19. A special hand check, and that was $375.
I move to approve consent agenda.
Second. We have the motion and the second for approval of the consent agenda. Any other discussion? All in favor say aye.
Aye.
Opposed? Motion carries. Commission comments. Ron.
Just awful thankful getting some moisture here, so that helped us out, and that's all I have.
Okay. Thank you, Craig.
I have nothing.
Earlier this morning in our work study session, Ken Campbell was here with the Dickson County EDC, gave us an update and kind of a window of what had taken place, and mentioned that there are a lot of building permits, but also specifically there were 3 houses sold out in Golden Belt. So that's good news for that development, and really provided us with a lot of information and things that's taking place throughout the county. Martin Tannehill also was here and to brief us on the asphalt bids and a little bit the situation with rock and so on. And then Emily Nichols with 911 was here in regards to her department. That's all I had. We do not have any petitions. We do not have any proclamations. Would there be any other, I guess if there's public comments, this would be opportunity at this time for that. I might mention that we had a little bit of a technical difficulty, had to reset on the computer this morning. And, unfortunately, not much we can do about that, but just work through it and with the time restraints and so on. But so appreciate your understanding on that. We do not have any public comments, so we'll just move right on to our reports. County officers, Janelle.
So surprisingly enough, this week was somewhat quiet from what the managers were telling me. I've probably just now jinxed us. So the couple things that I wanted to mention to you outside of the bids that you've got, we've got the highway department. Martin advised that they will be out brining in preparation for the possibility of snow this weekend. So look for our trucks out there. And next week on the 25th, we will be in Topeka for Local Government Day, and that's in conjunction with the Kansas Association of Counties and the League of Cities. Forget their terminology now, League of Municipalities. So we'll be meeting with them and hopefully visiting with some of our legislators and bringing some information to them about our county and some of the issues that we are facing. So that actually is all I have for you today.
Okay, thank you, Doug.
So we're knee deep into the tax sale process. We've sent out summonses, given those to the sheriff's department to deliver summonses, and we probably have, I imagine paperwork, we probably had 600-700 pages of papers that we delivered for delivery to service the process. We're looking at an April 5th date would be for the court proceedings, is when we would ask that the court would grant judgment against the case. If there's any cases, there would be a case that would be set for another date shortly after the judge would hear the other case if there is any challenges to the outstanding taxes due. We've also this morning, we prepared our paperwork to go off to the other counties that need to be served because we have people who are living in other counties that own property here. So we've done Johnson County, Douglas County, Shawnee, and a number of other counties that we've sent the paperwork out for service of process. And so we're moving forward on that. And this one individual has taken the opportunity to get the taxes paid before April the 5th, because April the 5th, another $550 will be added to it if we're successful getting a judgment for that, because that's statutorily set forth in there. So hopefully the people will get their taxes paid up for that period of time. That's all I've got. Thank you.
Thank you. Notices and communications, there is the 78th annual meeting for the Dickinson County Farm Bureau. And the county commissioners have been invited to that. And so we'll need to RSVP if we are planning to attend, and probably wouldn't hurt to put it on the website anyway.
Right.
Most likely all of us or a couple of us would be there. Was any other notifications that anyone did receive? We do not have any resolutions or unfinished business. We'll go on to other business. The first item we have is to approve the asphalt bids on Old Cordy from Chapman city limits to the East County line. And so, Janelle, do you want to give us kind of a summary of what that involves?
So commissioners, we requested bids for 3.5 miles of asphalt work and shouldering from the Chapman City line, Chapman City boundary east on Old 40. We received bids from 3 companies, Schilling, $663,710, APAC Shears, $671,199.75, and Bayer Construction, $874,150 even. And in looking at those bids, we also asked Martin decided that he would take a look and see what they could do on the project as well. And he put together some information, what he's estimating the county could do the work for, and that is $452,193.50. So this would mean that he would expend his road maintenance work for the summer by 7-8 days, therefore is what he's estimating to do. It means that maybe we wouldn't be installing some culvert someplace unless it was an emergency, but it's not anything out of the unusual. We're not taking them away for any other work. So actually the recommendation would be that we would utilize county staff to do the work.
Okay. And in the work study session, he had mentioned, as you did, that it'd be about 7 days to do that, 4 days for the shoulders. And that's actually a little bit of a buffer. It could be less than that, but the highway still would be open.
Right.
As far as it'd be one lane and a pilot car. And but once it was completed, I mean, we'd have things taken care of pretty well there. Are there any questions, or do we need a motion for?
We need a motion.
I don't know as we do, because we wouldn't be accepting a bid from any of the other vendors.
Well, other than maybe to direct that we're doing it in-house, so I guess for their benefit.
We can notify them that that's what we're doing, so.
Yeah, I just say notify.
Yeah,
Okay.
we're not accepting a bid.
Okay. The next item we have is to appoint Andrew Kalovich as the trustee to the Reinhardt Township Board. And we had a letter from Lauren Barton in regards to that. He is the treasurer of the Reinhardt Township. And also Cody Hutchinson, the township clerk. So is there a motion to appoint Andrew Kalovich to that position?
I'll second it.
We have the motion and the second to appoint Andrew Kalovich as trustee of the Reinhardt Township Board. Any other discussion? All in favor, say aye.
Aye.
Opposed, motion carries. At this time, we'll have a Dickinson County Board of Health meeting.
Excuse me, we have the added item.
Okay. Okay, so we'll put the added item in next, and that is a culvert bid. And you have that information as far as that was from Wellborn.
We have two bids that came in for a culvert at 493 2600 Avenue. And this would be an 84-inch arched, 36-foot, 12-gauge aluminum culvert. Wellborn Sales has an estimate of $5,310.36. And Contact Engineered Solutions bid $6,545.88. So our recommendation would be from the bid from Wellborn Sales. Looks like it's 3 to 4 weeks before it would be delivered.
They deliver
They would deliver it, yes,
right beside Brown.
yes.
I'll make that motion for Wilburn Sales to accept that bid.
Second.
We have the motion and the second for the low bid of Wellborn for the culvert, $5,310.36. Any other discussion? We have the motion and the second. All in favor, say aye. Aye. Opposed, motion carries. And so procedurally,
I move we adjourn.
I'll second it.
we have the motion to adjourn and the second. And then, of course, after this adjournment, we will have a Dixon County Board of Health meeting. So to adjourn the regular session, all in favor say aye.
Aye.
Opposed, motion carries. We're adjourned.
And you should have an agenda for the Board of Health and then John's side.
Is this cell phone coverage or on an ad? Okay.
Wouldn't be that heavily populated probably.
Okay. Does everybody have everything they need? We'll go ahead and at this time, I'll open the meeting for the Dixon County Board of Health. This is the January 19th, 2023 meeting. And we have the approval of the agenda. Is there a motion to approve the agenda?
I'll make a motion to approve the agenda.
Second.
We have the motion and the second to approve the agenda. Any discussion? All in favor, say aye.
Aye.
And point of clarification, who are the voting members of the
The three commissioners.
three commissioners? And
You vote?
then
Oh, just you three.
okay,
Up to you.
I was thinking there had been some discussion whether the others would be voting members or not.
And I think originally, several years ago, maybe it was a little bit different during COVID.
Okay, so just for clarification, then there were three that were voted for the approval of the agenda, and there's just three of us that are voting
Correct.
members.
Yes.
And then all in favor, say aye.
Aye.
Opposed, motion carries. Okay, so now we'll move to the next point, the review of the prior year.
Hey, good morning. John Holtgren, Director of Dixon County Health Department. I did give you kind of a synopsis of what the last year consisted of as far as services provided by the health department. The WIC program there, the numbers are there. That it stayed about even. It looks like the state is going to kind of, it has been virtual since COVID and it still stays virtual at this point, but it sounds like they're getting to the federal government, I should say, on WIC is getting to the point of maybe looking at going back to some in-house WIC visits, but they're also, which my guess is they'll do is keen with the idea of giving the person the option of either coming in or doing it virtually. Some downsides, upsides and downsides to both. So the numbers have remained pretty strong with that, even through the COVID. We did have a community baby shower again this year that I think I reported on before. We had 42 pregnant or postpartum women that attended and family came with them. And so it went over well. We were kind I'm glad because we've been accumulating a lot of stuff that we didn't have it for a couple of years through COVID. And I got a lot of stuff out of the storeroom as far as cribs and car seats and stuff that have been donated for that. And that always goes over well with those people. And we've kind of changed it over the years on how the vendors came in and how they presented and that sort of thing. But typically we make the attendees go around and visit with all of the vendors. They have to, you guys have been to the little thing, you have to get checked off as you check vendors before you're eligible to win prizes. So it's really a vendor fair that the vendors come and want the opportunity to be able to talk to everybody. So they have to kind of go around as a group and be checked off that they make contact with the vendors and then to be eligible for the prizes. And they have food and it's a good event. So we do have the next one planned for June 28th at Sterile Hall again.
Question for you, John. Going back to the women and infant children.
Mhm.
Refresh me in just what all that involves. I mean, is there money involved with?
It is. I mean, there's money involved, but it's the program where if you remember where young parents, I don't have a young parent, but parents that have kids and they meet guidelines through the federal government, income guidelines, they get the vouchers where they remember the whole list of stuff that applies, so they can go to the store and get milk, and there's a whole list of food items that qualify for WIC, and then turn it in there. It's gone to, used to get vouchers. I say vouchers, but they've come high tech now. They have cards now, like credit cards.
Put so much money on a credit card and you can go in.
Yeah. And they can buy certain stuff with that every month. They get that. And so, yeah, it's a credit card now and they pay for it.
Is it income based to get into this?
It is income based, and they have to meet certain guidelines. They have to come in and the kids get checked out. I mean, it's a process to meet with the nurse and go over how they're doing and how the kids are doing, and so it's not just to come in and we give you the card and you're good to go. So, and they have to have frequent check-ins. There's a dietitian. We have a dietitian that's hired. And they're required to meet with them as well. So on a frequent basis. So it's a process. And this is one grant that is government. It's not, I mean, the federal government. It's not a state run program.
And is there a, like baby to 5 or what's the time limit they can be in this?
Yeah, I forget what but it is infant too, because you can get formula through it when the baby's young.
I didn't know if, it got to be a certain age.
I think it's through kindergarten. Yeah.
Okay.
So.
Okay.
Jean takes care of that she's the nurse that takes care of that. She's taken care of that for a long time. Does a great job at that. So.
Be hard to replace.
She will be. And I made comment the other day that we had a family in that the children were a little, made a little bit of noise. They were having some vaccinations done. I kind of missed the days because Jean's office is right next to mine and it's been pretty quiet through COVID in there. But now with the kids coming back, it'll start up again. I had a phone call one time and the person on the other end of my phone said, "My gosh, what's going on in your office?" I said, "That's an employee." So
You demand payment in advance.
it is entertaining. So anyhow, foot care services, that's going gangbusters. We have one nurse that's doing that now, and she's also the school nurse down at Hope, and she could probably be doing that full time. As much response as we have. It is, as you remember, a donation program. And we really, in checking with her, and of course, we put a kiddo out there and we're not supposed to know whether they donate or not. But we do have quite a few people that donate in excess of what the ask is, solely for the purpose of those that maybe can't afford it. So it is a good program. And if we have to cancel for one reason or another, it's
Back them up.
it's backed up pretty good. So We hate for that to happen. So it is a service that's certainly needed out there. And
I know people in Chapman that are diabetic and stuff.
yeah,
And once a month they come over and really,
yeah, it's a good program.
because they don't want their spouse cutting their toenails off.
Very careful.
Yeah.
Really careful. So,
I think that's 15.
yeah, we're up to 15 now. But again, we have people, a lot of people throw a 20 in
Yeah.
just, you know, to make up for those that maybe can't or miss a month or whatever paying.
Or having your spouse do it. She's probably throwing in, or he or here.
Right.
Don't have to do it.
Rabies investigations, we had 32 last year, which was up for whatever reason. I don't know, more dogs running loose, or animals, I should say. It's not limited to dogs, obviously. We have people bit by raccoons and bat. Sometimes, we haven't had a bat in a while, but we've had some investigations with bats. So anyhow, it's, I don't know what reason, but it's up a little bit. Injections, and this is just all vaccines that we gave last year, and then we kind of broke it out with flu vaccine, which included our 16 school sites, our 3 community walk-in clinics, and the rest were done by appointment at the health department. And then we threw in the COVID vaccine down there too, as what we gave. And those could be, there could be a small amount of duplicates in there, so it could be, that's not necessarily 1,178 different patrons. That could be, you know, if they come in for one shot and then come back for their booster shot. So that was just the total dose. I also ran off just some interesting thing. This is back to COVID, and I cringed when I did it, but I ran it off. But this is that first sheet there is daily number of new cases, and this is in Kansas, as you see. So there at the far right-hand side is the most current. So you see that last year on 1/1 of 22, you see that's where the spike is, right in the center. So obviously we're a lot less than we had last year, and that's when the initial Omicron variant went through. So you can kind of see where the state is there, and then the bottom one is really the same thing, but that's Dickinson County and not the full state, which kind of mimics the state. Right now on the next page, we are in medium level, food level. So we're no longer in the high, which is good. So and then the next one down is the rate of vaccination with COVID of those people 18 years of age. So we are currently standing at 63.4% of the population of our county is classified as completed their vaccine series, which is had their initial shot and 2 boosters. The next one just is hospitalization, and that's currently up to date. The top one is North Central, so that would be any hospital within the North Central area. And that just tells you down at the bottom, that red area is how many hospital beds are filled with COVID patients. That gray area is all hospitalized patients, adults, and the blue is inpatient beds available. So out to the right side, you see that there are beds available. You see that not many beds in the North Central region are being filled by COVID patients. It's really low there. As you see clear to the right, it's almost dropped off to nothing. The state is down below. That's the full state that matches that, the same information, and even state. You can see that, after about the first part of May or April this year, that it's really held pretty steady, pretty low compared to what it was. And the last page, I just threw this out. This is as of today. This is the United States, and in areas that have the highest rates are those in yellow and that kind of orangish color. So you see that right now the highest activity is on the East Coast. That's where the population is. So you see up around Washington and New York, you see most of that is orange. So that would be higher infections up there. So So a lot of the metropolitan area, see down in Florida, down at the Miami, you got high infections there right now, and in Texas, along the border, it's high as well. So that kind of gives you, and then you see the rest of the country. If it's green, you're in the good. So, and then yellow is the one right above it. So yellow and green are the better ones. Green is the best. So you see most of the Western, Midwest and Western states yet are low right now as far as COVID transmission. So, but obviously, like I think I mentioned before in the last week or week before, maybe that, with the new variant, which is being tagged out east primarily. And so that may change a little bit. Unfortunately, we may see some of that yellow and orange color start working our way as that spreads. So we would like it to stay like it is, but afraid that it might. So new cases down below there with that graph, you see that's just, you do see a reduction in cases there. And this is nationwide, this chart. So that's kind of good that, and this is over the last 90 days. So that scale is 90 days. It's not marked off any shorter than that, but each one of those marks is a week. So in the last, 6, 7, 8 weeks, they're seeing a pretty dramatic decrease, and that's nationwide. So maybe we'll keep our fingers crossed. Maybe it's not going to be as bad as they had feared. So that is a report on any questions you guys? That's last year's numbers.
I have no questions. All right, Ron? Any other comments?
I will talk a little about, we met, and this has to do with health, but it's kind of a healthiness together thing that we were asked. I don't know if I brought it up to you guys, but several years ago prior to COVID, we talked about the possibility of looking into what's called a community paramedicine program, where you have paramedics with some extra training that could go out and see patients that are dismissed from the hospital. The whole goal of the program is to keep people from being rehospitalized. And there's a lot of different ways it can follow. Sometimes they follow congestive heart failure patients. Sometimes they follow diabetics. Sometimes they follow somebody that's post-surgical and they go home and the doctor says, hey, I want somebody to go out to their house once a week for the next 5 weeks just to check to make sure their wound's healing and they're doing good and they're taking their medicine like they should. And then it's on direct physician order. So the physician would have to order that happen. It's the downside to it, and there's places that have done it for several years now and been really successful with it, but the downside to it is that it's still in the sample size, even nationwide, that insurance companies, there are some insurance companies that are paying for it, but it's just now becoming big enough that more and more insurance companies are seeing the benefit of it and paying for it. So since we were interested before, it's now KMSAR, EMS Association, has a legislative person that lives in Missouri but it's heavily involved with Kansas too. And it's really taken off in Missouri, and there's several smaller services that are doing it in Missouri and really having good success with it. And it's got attention in Missouri, and now they're wanting to come across the line and get Kansas. And what they're wanting to do is do pilot programs so they can get a sample size to take to the insurance company and say, here, it's worth it. It's worth what you're going to pay for. In doing so, they come to us because we were one of the services of before, and I guess they're looking at 3 services in the state. We are one of them. And we met with them last week, and we also met via Zoom in that same meeting with several people from Missouri that are doing it currently, starting it, and offered if we chose to proceed, that they would offer to help in doing that. On part of the funding for the pilot is through grants now, because they have the ability to pay for startup costs. And they're looking at a 3-year pilot program, and they would fund what it took to maintain it for those 3 years for it to get up and going. So, and they have talked to the Patterson Foundation. And if you remember the Patterson Foundation, which is an offshoot of the Cerner Corporation that's housed in Kansas City, they are willing and wanting to come up and spend some money, and they're wanting to support 2 sites in Missouri and 2 sites in Kansas for the pilot program. So, and it talked like it could mean to each service $300,000 to $500,000 for the 3-year pilot, and that would assist in buying any supplies you need to get up and going, equipment you need to get up and going, and then furnish the salary for that person that would be doing it. So it's interesting to look at. I think it's a concept that might prove beneficial. And I can tell you that, I guess we're lucky that maybe we were offered a pilot program, because if it does go off, then a lot of places will start doing it, but they're going to lack the ability to have the equipment and stuff paid for like those in the pilot program. They would have to start from scratch. And really to make it successful would take a lot of legwork, but it's not unsurmountable. It's certainly, to make it successful, you'd have to have good relationships with the providers, the physicians, and to say, hey, we're willing to have you go out and check on these patients, and they would have to write a script. But obviously, so it takes some legwork to go out and talk to the physicians here, which I've done with the hospital here already, and Salina, because obviously anybody that any of our residents could, Junction City would be another one. The clinic would probably be a big one in Junction City. Dr. Freese now, Chapman works for the Kansa, which is the only federally funded healthcare clinic we have. So they probably would, if they had people within our county. They have a lot of people that sometimes miss appointments. They don't show up for their appointments, and what they would do in this case was they would assign one of us to go out to the house, make a visit at the house, and then they could make sure that those patients were seen. If we do it, we wouldn't look at any patients outside, patients within our county. We would not be looking at patients in another county. But so we thought we'd throw it out there and get you guys. We've not signed on and said, yeah, we want to do it. But there are 3 services that they're looking in the state of Kansas. Garnett was one, and down Kingman and down in that area was the other one. So, but it's a pretty short time frame that we have to make a decision, because they want the applications to the Cerner Corporation by the first part of February. So it's pretty fast. So, and they have a gal that's done the Missouri work that was on the line the other day, and she said, she'll help with whatever it takes whatever we have to fill out application wise to get it submitted. So we have help in doing that. So, I think it's something that is obviously working and really taking off in Missouri and growing in Missouri, and Medicaid would be another big player in it. We are fortunate enough now that I think, as you remember, last year EMS got a big increase in Medicaid rates, which we were solely behind the rest of the country for years, and now the attorney that used to be the attorney for the Board of EMS for quite a few years, she is now the head of the Medicaid Kansas. So she was very instrumental in helping us get that increase, and she's still there with the no change in the governors, that she's still person that's going to be there. So I think she would be instrumental in helping get Medicaid to go along with providing some payment for these services too. So for us, if we took it on, we wouldn't increase any staff at this point. We could do it internally. We actually have the fortunate side, we actually have a paramedic that works for us that used to be a community paramedic in Michigan for 4 years and helped them get their system started up there. So we have a bonus there that not everybody has. So we have somebody that's already trained to do that.
Does home health do any of that?
Home health does
Or how would that, I mean,
does a little bit of it, but what we would go in and do, we would have a machine that we could draw blood and give an instant reading with that. We could do, there's some overlapping with it. We've talked, and that's why I went to the hospital here, because the hospital here runs home health in our county. And there may be some times where it would coincide with home health, but in other places, when we talked about that, they said actually it increases home health, because some of the people that they would release and say, we'll go home, and after the community paramedic visits them about their scheduled time, and then they go back and report to their physician and say, well, this person needs some ongoing health.
so there's a gap there.
There's a gap there, and it would actually may then increase home health,
Mhm.
because in that case, the person wouldn't have initially got home health, and now you suggest that they have home health. This doesn't give people baths. The community paramedic doesn't do baths and that type of thing. They just do home visits, much like the physicians used to do back when we can remember, when your physician used to come out and do a home visit.
I remember.
That's why I looked at you.
I know. Lynn lives in town.
In a lot of cases, they carry a small pharmacy of, say, somebody ran out of a medication or needed a medication, we could give them a pill or two to get them by. So it's a unique concept, and like I said, other states have been doing it for quite a few years. Colorado's been had programs for several years. And at the end of our 3 months, or 3 years rather, if it's something that doesn't go over, we're not out anything. We simply, it ends and we're done.
That's a good opportunity.
It is.
The training for this, it's beyond, what does that involve? I mean, you say you've got one person on staff that's already, I'm sure there's,
He could train the others.
okay, so it's not something,
And that's the benefit that we have.
okay.
There's parts of it that in the state of Kansas, a paramedic is able to do anything that a physician prescribes them to. So the physician prescribes them to, he trusts that they have training to be able to do that.
Okay.
So it's within the scope of practice. They just need to be trained in it. Like, otoscope, for example, the little thing that the doctor looks in your ears, we don't do that as paramedic. That's nothing we do, but they would at this case. So that's just training in that. So it's not big. And like I said, got the benefit. We've got a person and it's already done it. It's instrumental in getting a program started. We have a lot of benefits going for us. And I think they like it with the fact that we're attached to a health department as well. If we ever needed a second opinion, we would send a nurse out with them on a call to the house, and they could assess a wound or anything like that. So we have the ability to do that a lot of services don't. So we've got a lot of pluses in doing it. If there's anybody that should succeed at it, it ought to be us. So, yeah.
Well, sounds like a good opportunity and good match with the funding there.
Yeah. So unless you got any big thing, and again, we won't exceed what we get as far as budget wise. So whatever they give us is what we'd have to live with, without coming back to you guys and saying, hey, we've got 50 people signed up. We're not going to be able to do it with that. But typically when you sign somebody up, we stick them with the same person, same community paramedic. They go over and meet with them before they get dismissed from the hospital. So they talk to them and familiar with them. They do each time they'll do a fall risk assessment when they go into their house the first time, which our people are trained in that. We go out and do that to people, senior citizens in ad groups. So we have several people that's already trained in doing that. So telling them things they can do, don't pull up your little rugs that are laying around and put a bright colored cover over your couch or chair so you can better judge distance from when you go to sit down. And, you know, there's people that, you know, are fall risk going up and down stairs because they can't reach their light bulb to put a new bulb in. And our guys have put a new bulb in with their staircase so they could see. I mean, just things like that you find when you go into the house that sometimes they don't tell you until you go there. So each patient would get that. So it's a lot of stuff involved in it. So, and like I said, it's not without work getting it up and going. And if we're successful in being one of the communities that are to get it. So if we did not get the grant, there's other grants out there that you could apply for. And it could be that, and we would look at that if we didn't get it or if we got it, but you know, we got so busy that we needed more money than what we were getting from that foundation that we could go to another grant and get another grant written and be able to add additional services. But I think it's doable. And I think it's a good opportunity if we're going to look at it to have some funding to be able to do that. So.
Is that something you do on your own initiative then? I mean, you don't need a motion or a consensus for, I mean, I guess you have a consensus and just.
Yeah, I don't think
it's an in-house, it's under.
Yeah, it's just a different program.
Right.
Yeah.
So we're looking at some.
Well,
I appreciate you letting us know.
well, if we didn't want to do it, we'd say no.
Yeah.
Exactly.
Right. Say yeah. And I would leave and it'd be a lot less work for me. But I think it's a good opportunity. I think it's a good enough program to
Explore the options.
And this gives us the 3 years. And if it doesn't work out in 3 years, you simply walk away and they know that's a pilot program. That's why pilot programs go. And if the insurance companies by then aren't paying, maybe you say, well, we'd like to do it, but we can't afford to do it. And then that would be a decision that we or you guys would come in to make. It's if insurance is not paying for it, is it something that we have 50
Not picking up.
lined up?
Yeah, and if they're not picking up all of it, what percent would we want to pick up?
Yeah, should we continue that?
Sustainability is gonna be,
Yeah.
is the thing.
Sustainability of it.
Well, and I'll go back to the fact that as long as you keep somebody out of the hospital, which you'd think the insurance companies would want to do, pay part of it,
That's
That's
the
another
key. I tell you, they're
factor.
busy enough. And when I went down to the big service at Fort Worth a couple of years ago, they do it. And they have people roaming out in vehicles all the time, seeing people. And when they tag it in their system, which we would do that here, if we got a 911 call and this was a community paramedic patient, they would notify us, and down there, they will send the community paramedic out and meet the ambulance there. They're familiar with the patient and they may keep that patient from having to go by ambulance to start with, which is a bill for us, it's a bill for the hospital, and they could take care of their problem without being transported. So, and obviously the hospitals suffer if somebody's hospitalized and they get released, if they come back in 10 days, within 10 days of dismissal, the hospital can suffer a penalty because of that. So it's to the hospital's advantage to
make sure they send them home.
make sure they go home and they're home for 10 days. But because if they come back for the same condition within 10 days, and the hospitals get dinged. So.
Well, it would help some people, and like Craig said, and you had mentioned, it helps keep some people out of the hospital, but it also helps keep them in their home. Which a lot of people
We will
can
be
comfort
part of
with
the
that.
study that they will collect information from us to send to these insurance companies, but you understand why the insurance companies are behind it. They're seeing that it's cheaper for us to go out there than it is to have these people go back to the hospital, and certainly keeping the people well at home. So it's a win-win. Keeps people out of the hospital and safe at home, so well at home. So I think it's worth
Bringing that up.
So, okay.
Anything else?
I'd say we give them permission to
Explore.
explore.
Thanks for the work.
Thank you.
Is there a motion to adjourn?
Thank you.
I believe that's all we have.
Did you correct me?
No, I said no, thank you.
Oh, I'll make a motion to adjourn.
I'll second it. Any further discussion? All in favor, say aye.
Aye.
Opposed? Motion carries.